Thanks so much for being with us. We appreciate it. Listen, having heard those numbers and especially seeing that chart, that graph we just showed, should we be less fatalistic when we look at the actual rate of death relative to the number of cases?
Well, I think there's a lot of things to consider here. First of all, it's common for the case fatality ratio or the mortality rate to go down as we learn more about a disease, both because we do a better job of treating patients who are very sick, but also because we do a better job of identifying additional cases. The big thing that I think is an issue here is that we have a lot of young people really driving the transmission summer. And while they are less likely to die of COVID, they are also the ones who are going to spread it indoors. And our older, more vulnerable population may be less able to protect themselves from COVID as everyone moves into a more indoor environment.
Okay. Let me try and get a different perspective on the graphs we're seeing. I mean, if we'd been able to test at the rate, that we are testing now, back in March and April, how bad do you think the mortality rate would have looked earlier on in the pandemic compared to today?
Probably better. Certainly, our increased testing is identifying more and more mild cases, and that is increasing the denominator, so making the death rate look lower. And that is probably closer to the true death rate for this disease. But remember, when every single person is susceptible to the disease, we can still see a lot of dead human beings.
Right. Emily, our last serious pandemic was the Spanish flu. It faded, correct me if I'm wrong, after about a severe, 2-year cycle. Tell us how this pandemic actually compares to that. And might we actually see this 2-year cycle the same with the coronavirus so that it does eventually fade out on its own?
Well, it's possible, but it also has a lot to do with the fact that we're sort of accelerating the rate that Spanish flu went through our communities, largely because we are so much more connected, traveling worldwide and doing things differently, being more connected than we were at that time. So it could be that we get to herd immunity, which is really what helped the Spanish flu to die out. We could get there faster, but I'm really hoping that we see a vaccine or a number of different vaccines across the world that really help to add to our other methods of protection, like face masks and distance and better ventilation. And maybe then we'll be able to get this under better control and keep it under control with regular application of the vaccine. I imagine that someday we'll probably see the COVID vaccine co-formulated with influenza vaccines that we get each year in this season.
Right. Okay, take out your medical crystal ball then quickly and give us kind of a time scale for how you see this going, knowing how the trials are going, where the vaccines are being produced and tested. When do you see us finally returning to so-called normal?
I think there's been a lot of optimistic press, especially in the United States, about a vaccine being able to be distributed very quickly. That's probably not the case. There are not going to be enough doses for every American for many, many months still to come, even if multiple vaccines are available and sort of pass the test of the phase 3 clinical trials. So I think we're looking in the United States at, I think Robert Redfield's his prediction that we would have good vaccine and that would help us really get a handle on control of spread, probably into third quarter of next year. And then I think there's the rest of the world will need to have vaccines as well in order for us to sort of return to our regular lives of traveling, which I'm really excited to do. And I think we'll have to make even more doses, billions of doses of vaccine will be needed.
Okay, Emily Landon joining us there. Thanks so much for being with us. We appreciate it.